A dentist is basically a doctor of the mouth, just to make things simple. And my job is about helping people who have problems with their teeth and with their gums. My day-to-day job is I do fillings on teeth that have holes in them. I also take out teeth that are very bad or giving a lot of pain. And my favorite part of my job is I make teeth look nice, and that's by making them look straight or making them look white. This is my favorite part because it basically, I get to see how it boosts somebody's confidence because it gives them the ability to smile. Someone who is very shy and they cover their mouth when they talk, by giving them, changing their smile, really makes them feel more confident at what, when they're just day-to-day life, yeah? And I'll give you a fun fact. So in psychology, they found that when you look at somebody for the first time, when you look at their face, the first thing you look at is their eyes, and the second thing you look at is their teeth. So teeth are very important. It actually affects your job prospects. When you go for an interview, people who have good teeth have been known to get better job prospects. So it does have an impact on your life. And when I'm part of that journey and I'm able to help people have better smiles, it makes my job more worthwhile, basically. What else I do in my daily job is I educate my patients. I teach them how to look after their teeth. So we go through brushing tips, I go through flossing tips, and I go through a lot of diet advice, because prevention is definitely better than cure. And I spend a lot of time educating my patients about all of this. Okay, let's tell you about the skills you need to be a good dentist. So number one, you need to be good with your hands. And a dentist, as you know, works with very small instruments, and we work in very small spaces. So you need to be able to use your hands very, very intricately. So that's a skill that you need. Number two, you have to be artistic. If somebody's broken a front tooth and you have to fix it, you need to do it in a way that makes it look very natural. You need to be able to choose the right color of the tooth. And believe it or not, there are so many shades of white. So we have to be good with our eyes and have an artistic side to our career. So that's a very good skill. Also being good at problem solving. So patients come in and they have lots of issues with their health, with their mouth, and you need to be able to step back and set up a plan for them. So you shouldn't be scared when you see someone who has lots of problems. You need to take a deep breath and be able to solve these problems one by one. So I need to basically be good at communicating. Communicating is it's something that you need in day-to-day life, but as a dentist, you need to be able to explain difficult treatment plans, difficult plans to patients without using very big words that only a dentist understands. You need to be able to go down to the level of the patient, who might be somebody who doesn't even speak English. You need to get another person involved, or it might be a child. You need to be able to talk to on the level of a child, or it might be somebody very educated. So you need to use you need to change your communication according to your patient. And that moves on to the next skill, which is being a good listener. Women are definitely better than this than guys, I'm sorry, but girls are much better at listening, because what happens is when somebody starts talking, what they found is female dentists are more likely to let the patient talk compared to male dentists. They'll interrupt quite quickly and start giving in the advice, whereas being a good listener is taking a step back, letting the person talk and tell you all their problems before you come in and tell them what you can do to fix it. Okay, so that's a very good skill. And the last skill, which might seem a bit like you need this in day-to-day life, is basically to be friendly. Patients who come in, they are scared of the dentist. Nobody likes going to see us, unfortunately. We don't have a good reputation, but when you're friendly, it just makes everything more comfortable for the patient because they relax. And what I do is I make jokes with my patients, I laugh with them, and this helps them to calm down. And this is definitely a skill that patients appreciate because it makes the whole experience so much more pleasant for them, yeah? Let's talk about now steps to becoming a dentist, okay? So number one, you need to work hard in science. It seems obvious, but it's true. Biology, chemistry, physics, definitely from your young age, put in the effort when you're studying. It forms a foundation to understanding the body and understanding how things work in the mouth. So that's a very good skill to have, and something you need to really work at. And number two is to have a hobby that allows you to use your hands. For example, doing some painting, or doing what I did, which was basically I learned to embroider and stitch and embellish, like add little beads to scarves and just make them look pretty. And it just meant that when I was working in the mouth and I had to, for example, I had to put a stitch in somebody's gum, I found it quite easy because I was used to using a needle and thread. So these things that I've done as a child helped me as an adult. So this is ways that, what can you do? These are skills that you can use, and anything you can do. Like, for example, you can be good with your hands working with like DIY. It can also apply, yeah? Another thing is doing lots of reading. Reading really helps me improve my vocabulary. I had a lot more words I can use to explain things to people, and this helped. So I would recommend as much reading as you can. This will help with all your subjects, and it will help you get into anything you want to do, because reading is the foundation of your education. So that's something that I would really recommend. And then you move on to, you get a bit older, and then you need to do your GCSEs. You have to take things a bit more seriously. You definitely need to work hard at your GCSEs and choose subjects that help. I remember I did textiles, which is like sewing, and I even took my my project to my university interview, and they were happy to see something like that because it shows that I can use my hands. So you can choose a topic like design and technology, where you're working with like woodwork, or you can do art where you're painting. Anything that shows you're good with your hands is also very useful. And then you become a bit older, and then you move on to doing your A-levels. You do need to choose a topic that helps you get into the university, and that includes like sciences. So I did chemistry and biology, and I also chose a humanity, something called psychology, which is the study of human beings. And this I found extremely useful when I'm working day-to-day life, because it means I can read people really well. So psychology teaches you about human behavior. And when I see, say, 25 patients throughout the day, I'm able to assess them. You know, this patient's really nervous, I should talk to them this way. This patient is a bit more angry, I should know how to talk to them this way. So different topics you can choose can help you. So you can go into like any humanity, it helps to balance out the sciences. And you can choose a language. I did Arabic for my A-level, but you can choose any language because it helps you with your communication. You'll meet people in dentistry from all over the world. And if you're able to speak their language, straight away, they connect with you and they're able to understand what you're saying. So that helps as well. And then the final step is to choose a university that does dentistry. There are 16 universities in the UK who actually teach dentistry. And it means it's very competitive. So there's so many people who want to do this course. There's only a few places. So it means you have to work extra hard to get it, but you can do it. If you put the effort in, you can definitely do it. Let me tell you why I love my job now. So number one, it's flexible. And when you get older and you want to have a balance of your life, you want to be able to have a job where you can choose your working hours, choose your time that you work. And it means you get to balance your life with other things that's going on. Having a very stressful job that you're basically working a very long time can reduce your quality of life. So one thing about dentistry that I love is the flexibility. I can choose when I work, what time I work, and it's fine. And also I enjoy working part of a team. So I have a big support team, my nurse, of course, my receptionist, my practice manager. We work all together to help everything run smoothly. And I enjoy being the team leader. As a dentist, you're the one who leads the team because everybody looks to you to do the right thing and to set the tone of the practice. If the team leader is very friendly, everyone straight away becomes very friendly. So it's how you treat people around you. Your team basically mimic the team leader. And I enjoy helping people. When I change somebody's smile, I get them out of pain. It's very rewarding because they appreciate that, and it makes your job seem so much more worthwhile. And of course, I enjoy using my hands. I enjoy working with intricate instruments. I enjoy fixing teeth to make them look really nice and natural. So this is all applying the skills I've built up throughout the years, and I enjoy doing this, yeah? And finally, it pays well. Dentistry is a good career. It helps to pay the bills and a little bit more. It's a nice job and it pays the bills, so it's good. So that's from me, a little bit about dentistry. I hope that's clear. Let me know if you guys have any questions. I'm here to answer your questions.
There is a question, yes. Zahra, on the chat. Okay. Which good medical jobs can you get by doing A-level chemistry, biology, and psychology?
Good and medical jobs. Okay, let's see. So with chemistry, biology, and psychology, you can go into a lot of things. It opens up so many doors for you. You can do pharmacy. You can do, if you like science, which I like science, I enjoyed it. So you can go into dentistry, pharmacy, radiology, optometry, which is about the eyes. So what I would say is it opens so many doors when you do sciences. If you enjoy that, you can even go into engineering. Let's see the next question. I hope that's clear. Let's see the next question. They're good A-levels for radiologists, 100%. Yeah, it is. What's your opinion on tooth whitening? Teeth whitening, if it's done with a dentist, is very safe. It should not be done with anybody else. And on the spectrum, if we go on to like cosmetic dentistry, on the spectrum, if we think number 1 is very safe and number 10 is not safe, it's number 1. It's extremely safe to do if it's done with the right person. Okay. Very clear. Thank you. Any other questions, guys? How can you deal with stitching people's gums? I know it sounds really gross. A lot of people tell me, how do you put your hands in people's mouths? It's so gross, blah, blah, blah. It's fine. You get used to it. You're helping someone. You look beyond that. Just like a doctor can examine any body part, I can examine the mouth very comfortably. It's fine. And I can stitch someone's gum. If I've taken out their tooth and there's a big cut in the gum, I can't send them home like that. And it's okay. I mean, it bleeds a little bit, but once I close it, the bleeding stops. And it's all practice. I wasn't born a dentist. I took practice. First time I did it, it felt a bit gross. Second time, third time, I'm less nervous. And you just become good at it, and you become less, like, it doesn't make you feel sick. I think that's what they mean. What's the difference between psychology and sociology? It's a good question, because I did sociology for GCSE and I did psychology for A-level. Sociology is the study of society. So sociology is looking at society as a whole and seeing how, for example, the family network, whereas psychology is how does your brain work? How does a child develop throughout the years? It's about the person rather than society. How do people deal when they see a crime happen in front of them? How does it affect them? So this is psychology. It's about the person's brain and how they react, whereas sociology is about the bigger society. I have a question. What would you do with a broken tooth? So it depends. If it was just a little chip, I can fix it with a white filling and make it look natural. If it's a big break and they've got lots of pain and it's really bad, then we might need to do something called root canal, which is taking their nerve out, making it a dead tooth, and then we can put a crown on it. If it's really, really bad, then I want to take it out. Okay, how can we get children to have some work experience to get them interested in dentistry career? Unfortunately, right now with COVID, we're not allowed to have anybody in the practice. But inshallah, once everything calms down, and you guys are young, inshallah, by the time you're old enough to do work experience, contact me, come do work experience with me. I don't mind. You're all welcome to come with me. Just take turns. I love teaching whoever's with me. I've done loads of work experience students. I don't mind. How do you guys do surgery? Do you remember the first thing I said? I said, dentists are doctors of the mouth. So we do lots of surgery. We can take teeth out surgically. We need to remove a bit of bone. We can move flaps. We can cut a bit of gum, stick it somewhere else, stitch it on. So there's lots of ways we can do surgery. There's some people who have teeth stuck up right here, and we can basically dig it out and pull it down. So there's lots of things we can do surgery. What inspired me to be a dentist? I enjoy science a lot and I was good at it. And I like art. I'm good with my hands. So I felt the career brought the two together. What job I can get with sociology compared to psychology? So you can do, with sociology, you can go into studying society and looking at, for example, how many people now are actually getting married? How many normal like families do we have, like a nuclear family, for example? How many people are growing up in single parent families? How does that affect the children when a parent grows up, when a child grows up without a mom or a dad? So this is sociology. You can study society. You can be a teacher or a lecturer, or you can like do studies on society. What medical jobs would you recommend for chemistry, biology, and psychology and all other science? So you can become a doctor, dentist, pharmacist, radiologist, optometrist. There's lots of things that do anything with the body. Or you can become a scientist. You can go into be doing biomedical. You can go into research. You could be the person who discovers the cure for cancer. You can go into so many things that basically, if you think of science, you could be the person who discovers how we can recycle plastic and get rid of all the plastic waste. So it doesn't have to be purely medical. If you enjoy science, you can go into so many things and something you could be passionate about, or you can go into teaching. Would you recommend charcoal to apply on teeth? No, that's rubbish. Don't do that. Do you like being a dentist? I gave you 5 reasons why I love being a dentist. How many patients do you get a day? So it depends. If I've got big cases, I need to spend more time. So I'll book out long sessions and I see less people. Roughly, I would say when I used to do the NHS, when I used to work in the NHS, I would see about 20 patients. Now I work privately, so I do a bit more advanced stuff, which takes me more time. And I spend roughly, I see about, say, 10 patients during the day, roughly. Is having veneers damaging? So it depends who's doing them. If you're cutting a lot of the teeth, yes. If not, if you're being very conservative, which is the new way of teaching dentistry and working, you can just add on to the tooth and mask it. What age did you start to be a dentist? So I graduated when I was 23 and I was a dentist since then. Which one do you think is more effective for an overbite with gaps, metal braces or invisible aligners? Come see me for Invisalign. I will do it for you. Invisalign is much more comfortable. Metal braces are uncomfortable. Which toothpaste is good for teeth whitening? So there are whitening toothpaste, but they're quite abrasive. They're marketed in a way. If you want your teeth to be white, you have to whiten them, and that has to be done by a dentist. What are your thoughts of being a dentist before being a dentist, and what age did you decide you wanted to do it? So I went on work experience when I was 16. I enjoyed it. I liked that I was the leader in the team. That was really something, that's my personality. I like to take leadership. So being a dentist gives you that opportunity where you're the boss, basically. You make the decisions, and that's nice. I enjoy that. If you want to come and see me, I work in Acton Town Dental Practice.